Yes, concerns about you staying safe as you travel because of the news that is breaking this morning. And joining us now to talk about how to keep your family safe is family medicine physician Dr. Sujan Gogu. And doctor, thanks for being with us. You know, early on in the pandemic, the advice was to wait 7 to 5 days before getting a test. Now we're more than 2 years in. Does that advice still stand?
Yeah, it does. The recommendations are that, fully vaccinated people, they should be really tested 5 to 7 days after their last exposure. And then people who are not fully vaccinated, they should get tested immediately when they find out they're in close contact with someone. Ultimately, if they test negative, they really need to get tested again 5 to 7 days after their last exposure or if symptoms immediately develop. So the guidelines are still the same.
You know, I wanted to talk to you about what we were talking about in the commercial break going into the broadcast, which is that you were following the news coming out of South Africa from the health minister there. You say it's troubling when we talk about Omicron, this new variant, but also there might be some good news coming out of South Africa. What is that?
Yeah, so today the Minister of Health of South Africa, he really he gave a speech kind of about this variant, and I think a couple of things that he said that were good news. I feel like is that he stated that there's no evidence that really the new variant will evade our current vaccines, and he also specified that there are breakthrough infections at that, and that if you look at the ratio of hospital admissions, one vaccinated for every four unvaccinated is really what they're seeing there. But it's still to keep in mind, we still have a lot more information to really learn about this variant.
It's not often you get to be ahead of Dr. Fauci, but in this case, we'll see if we can put you at the top of the line. If I'm traveling, we have nonstop flights out of the Washington area to South Africa and many of the nations that are on the list now that the UK and the EU won't go to. Would you get on that plane and head to those destinations right now, knowing the limited information that we know with regards to Omicron?
Yeah, so I get the concern, about the variant. I don't think we still have enough news to really say whether we're going to have travel restrictions or not. All I can say is in the past we have obsessed about travel restrictions with other countries such as China, and really we've had COVID really enter the United States from a different part of the world, which is Southern Europe, in 2020. And so I don't really see why we will have travel restrictions, uh, moving forward. But I do think we, as the public, really need to be aware of, kind of what's going on with governments and seeing what they are doing, because that will subsequently impact, our travel.
You know, we have just seen the busiest day in 2 years with regards to travel. So many people taking to the skies. Some people have their shots, some people have their shots and their boosters, but millions in Americans don't. So how concerned should I be getting on that airplane and getting ready to take that trip? Because for a lot of people, it's not a battle between you and getting on the plane. It's a battle between their budget and the fact that they already bought their tickets.
Yeah, no, absolutely. I think the most important thing that we need to do as the public is obviously one, we need to all try to get vaccinated, try to get that booster because that offers us the most protection. I think the second most important thing is the mask is still one of the most helpful things that we can do to protect ourselves from other people and from ourselves transmitting and contracting the virus. So the mask is still there. I think we shouldn't be lax on wearing the mask. And I think the second most, a couple more important things that I think are still important is if we can socially distance, we should socially distance. And then obviously we need to wash our hands and maintain good hygiene. I don't think any of the three pillars of washing our hands, wearing a mask, or socially distancing to a degree have really not gone away yet.
And doctor, I'm looking at the Associated Press right now. The United States is banning travel to South Africa and 7 other nations. But I think what you pointed out is very important, which is that this is not COVID-19 of March of 2020. We now know things that we can do to stay safe. So do you feel more confident going into even this variant that will fare better than we did in the past?
I do. I absolutely do. I think we we have vaccinations. We have masks that are still there. We still have hand sanitizer, hygiene that's still there. We still have monoclonal antibodies that are still out there. We have doctors and nurses that really know how to treat patients much better than we did early on in the pandemic. And then we're getting more tools that are coming each and every day. Merck is possibly going to have a COVID pill, hopefully out there in the near future. And so I think we have more tools at our disposal now than we did in 2020. So I do think our outcome should be far better than it was initially.
Dr. Sujan Gogu, thank you very much for being with us, and have a safe and wonderful holiday season. And by the way, once again, to reiterate what we were talking about just moments ago, the Associated Press did say that the United States will ban travel to South Africa